As a basic scientist and in the laboratory most of the time, I don't get to meet people affected by Parkinson's.
We're very aware that it's the patients who have first-hand experience with the disease. They live with it every day.
We approached Parkinson's UK and they helped us set up an initial focus group which they facilitated.
We involved people in the development of our grant application.
It was quite a new thing to me. In fact, I didn't know what to expect.
I involve people with Parkinson's in developing the research question, actually by first going out to different Parkinson's branches.
It's not been difficult to find patients interested and willing to do this.
All of these people were recruited through the Parkinson's UK Research Network.
I distributed draft copies of our application to them, and after this they gave us feedback.
We conducted a series of focus groups.
We were able to address those concerns which were potentially going to come up with reviewers.
They provided really good guidance to me about what to include and what not to include.
It was fantastic. I felt so at ease and so relaxed with them, and they were really enthusiastic, which I found really nice.
I found it really motivating and it increases my enthusiasm for doing the research that I'm doing.
We can be confident that we've designed it in the right way for participants, and the PPI group was a big part of designing it in that way.
Personally speaking, I found the experience very rewarding.
It did have a big impact in enabling us to improve the quality of the research and finally get it funded.
We found a lot of things that we didn't set out to look for, but a lot of useful feedback came out of them.
I feel like it changed the way that I see clinical research, sort of the way that it's done and should be done. It's helped me develop as a research scientist.
Ultimately, I'm doing that basic science research to have an impact on them and their families and their lives.
It brought something new or different to the table.
There are questions that it is just easier to ask somebody affected by Parkinson's. They really are the best placed people to answer.
I don't really know how we would have conducted this study without input from people with Parkinson's.
It'd be really great to see other researchers making use of the PPI resource.